Hello everyone, I'm Khwaja Akhtar, a PGY2 resident in internal medicine at OUHSC, and today I'll be talking about cardiovascular outcomes of dapagliflozin and its a systematic review and meta-analysis. This is a list of the authors, and the project was directly supervised by Dr. Christina Murray from Cardiology Department at OUHSC. So SGLT2 inhibitors as a class have shown reduction in cardiovascular mortality and first hospitalization for heart failure in patients with type 2 diabetes. However, the published data is scarce regarding their effects in patients with heart failure with reduced EF, regardless of presence of type 2 diabetes. So our study question focuses on their outcomes in general population without presence or absence of type 2 diabetes. So the search was performed by two independent researchers in November 2019 and which utilized Medline and Embase as our databases. Keywords included dapagliflozin, heart failure, and cardiovascular outcomes, leading to selection of 739 studies initially. After removal of unrelated articles and review of full-length articles, we selected 4 studies for our final analysis, which were reviewed for statistics in Review Manager, and the results was reported as odds ratio, 95% confidence interval, and this Prisma flow diagram briefly outlines our search strategy. So this is the baseline characteristics of patients, and I have highlighted a few of the important characteristics, including history of type 2 diabetes, congestive heart failure, and prior history of heart failure hospitalization. And we can see that they are equally represented in both arms. Baseline medications of interest and the highlighted arms show that the patients in both the arms were being appropriately treated on guideline-directed medical therapy with ACE inhibitors and ARBs, diuretics, and beta blockers. So the results from our analysis showed that total patients were 22,487. Dapagliflozin arm had 11,257 patients, and placebo arm had 11,230 patients. Dapagliflozin led to significant reduction in hospitalization for heart failure with odds ratio of 0.71 and p-value being less than 0.05. All-cause mortality was also significantly reduced. Odds ratio was 0.88, confidence interval 0.80 to 0.98, and p-value being less than 0.05. However, cardiovascular mortality was not significantly reduced. Odds ratio was 0.90, but the p-value was more than 0.05, but there was a positive trend towards improvement. This diagram shows the forest plot of cardiovascular outcomes of dapagliflozin. Panel A shows hospitalizations for heart failure, Panel B shows all-cause mortality, and Panel C shows cardiovascular mortality. So the conclusions we can derive from this analysis include significant decrease in hospitalizations due to heart failure and all-cause mortality, positive trend towards improvement in cardiovascular mortality. We can safely say that dapagliflozin is associated with decrease in worsening of heart failure, and it shows clear benefit when used in patients with history of type 2 diabetes. And the benefits of clinical improvement in heart failure appear to extend to the patients without history of type 2 diabetes as well. This analysis lays down foundation to identify dapagliflozin as a potential add-on therapy to improve the clinical outcomes in patients with heart failure. I thank you all for your listening. Any questions can be directed towards my email. Thank you so much.